Since the inception of World Health Day in 1950, global health challenges have been highlighted. Health advocates have advocated for universal access to healthcare. The theme for this year is Our Planet, Our Health. It's meant to emphasize the relationship between climate change, planetary issues and our personal health. To discuss this further, I'm joined now by the Heart and Stroke Foundation of South Africa CEO, Professor Pamela Naidoo, who joins us virtually from Cape Town. Prof, thank you so much for your time this evening. Now, in preparation for this conversation, when I saw the theme, I thought, okay, we're going to speak to the Heart and Stroke Foundation of South Africa, and we'll talk about how everything we put into the planet comes out via food, and that has an impact on the state of our cardiovascular system. And that's why I was quite intrigued to read through your statement today, where you go much wider on the theme and how it affects our cardiovascular systems. And you point out that air and environmental pollution is said to be the fourth highest ranking risk factor for cardiovascular disease. And that's looking at figures coming out of 2019. That's quite worrying, and also quite telling that just our environment right now is having an impact on the health of our hearts. Talk to us some more about how that all works.
Yes, thank you so much for having me, and a very good evening to you and your viewers. A very important subject, because I think that many things that we take for granted in our lives is really, you have to look beneath the surface. So if you look at air pollution and climate change and other environmental damage, there's a number of causes for that. But, it's too vast to actually discuss it here this evening. But what I will focus on is if one takes, for example, tobacco smoking, and you look at how tobacco smoke pollutes the environment. And if you're close to any tobacco smoker, you can be a smoker yourself without realizing it, because you're breathing in what we call secondhand smoke. And so you then become an environmental smoker. And, that degree of damage that it causes to the harm that it causes to the body and to even the little ones and unborn children, it's quite worrying. So I think we need to take a much deeper perspective on this, and one needs to get to understand that it's complex, but it's certainly, there's more than enough evidence to show that environmental pollution in particular does lead to poor health outcomes. And of course, cardiovascular disease is one of those top, negative health outcomes.
Well, air quality is something that we're becoming far more aware of, especially in our metros, especially, I'm speaking to you from Johannesburg, and the air quality here is said to be really, really bad, if not of the worst of some areas in the world. We've just had that big court case in Mpumalanga as well, the deadly air decision about a very, very poor air quality there. Can you and your colleagues say that air pollution over an extended period of time is also having an impact on the health of our hearts at a more source level? If you talk about congenital heart disease, are you seeing an increase in congenital heart disease, children being born with heart defects as a result of people living in areas where air pollution is a major issue?
Yes, that is true, but I think that it's more especially prevalent in not just in little children, but in young people and older adults. So over time, if you're breathing in toxic air, it's very basic if you think about it, because for survival, we need oxygen. COVID-19 taught us how important oxygen is for survival. And so if you have your ozone layer depleted, that reduces the quality of the air you breathe. And oxygen is so critical to the functioning of the body, because if you are breathing in toxins, it's bound to create in your circulatory system, the blood flow through your system. If you have clots in your blood system, it will only damage your heart, but it will also lead to a stroke and other circulatory diseases. So you really need to think about damage over time, and that is why it's so dangerous, because it's not something acute that you just simply react to, unless of course it is causing an allergic reaction, which in some cases it has. If you take For example, a long-standing case in Merebank on the Merewent border. I mean, we know that a lot of the children in that belt that live there often suffered high degrees of upper respiratory tract infections, like asthma and so on. So we know it, but I think oftentimes the corporates haven't been quick enough to actually reduce the ill effects of the pollution that they cause as well.
Now, it does seem that if those numbers are not arrested anytime soon, the health issues that come as a result of it is only going to get worse. And I'd assume that the foundation is calling for a more multi-sectoral approach to ensuring that our environments are cleaner so that our health isn't affected on a large scale.
No, absolutely. You're so right. And thanks for raising that, because the multi-sectoral approach to this is the only way we're going to be able to reduce the harms of what is happening around environmental pollution. And yes, if you take key players in this would be the private sector, particularly in the sectors where they do, emit a lot of the toxins into the atmosphere, into the sea and oceans and so on, and rivers. And then, of course, government. I think legislation is a really key to reducing the harms and holding people accountable. I think that is really important. And then finally, one has to have some degree of monitoring and evaluation, some global standards that we have to all aspire towards as well. People have to be accountable.
Just in closing, before I let you go, in as much as tomorrow is World Health Day and the theme is our planet and our health, there are people watching us right now sitting on their couch. And of course, during the lockdown, we sat on our couch for far too long. So hopefully people are getting moving again, because you would, I'm sure, agree that moving is a very important part of keeping our hearts healthy. Is there a quick little checklist that people can do just to check in with themselves or check in on their ticker, as it were, just to make sure that everything is okay and they shouldn't have to go in and see somebody about it? What can they do right now where they're sitting?
Oh, yes, absolutely. That's a brilliant question. And it's really not rocket science. It's not that difficult. I think the first and foremost is know your history. So know your family history. Know your genetic predisposition. So if your family has a predisposition for heart disease or strokes or any other medical condition for that matter. Ensure that you know your own health status. And there are key common risk factors that you need to look out for. So check your blood pressure, check your glucose levels. So make sure you're not diabetic, because diabetes is also a risk factor for many other conditions. And then other simple factors is to just ensure that you don't have to put on don the gym outfit and go to a gym to keep fit, but you can keep moving, be active, walk in in a clean environment. Hopefully you are able to do that. And then, of course, nutrition. Nutrition is key as well. It's one of those pillars that if you are able to follow through on a daily basis, it's half your battle won. So ensure that your nutrition or the food you eat is low in salt, low in sugar, and low in fats. And those are just basically 3 ingredients. And you can still have very nutritious and tasty meals without really adding on these ingredients for taste, because we don't even taste our food. If you observe closely in a restaurant or other social settings, people use a salt shaker without even tasting their food. And there's naturally food and salt in your food anyway. So, it's simple measures that is not so burdensome that you can't actually follow it on a day-to-day basis.
Well, after that list, I'm sure there are a few looks shooting around the lounges of South Africa as they're watching us, as they check on what they've just had for supper or who's about to go to the fridge to get a little snack with their tea before they go to bed. Thank you so much for your time this evening. That's the Heart and Stroke Foundation of South Africa's CEO, Professor Pamela Naidoo, giving us some handy tips there ahead of World Health Day, being marked across the world tomorrow, I believe.